So, as I said, we're going to be talking about hyperpigmentation. I want to share a little presentation to share my screen. So, hyperpigmentation, we're going to be diving into this. All of the ingredients that treat hyperpigmentation, we can divide them into two families or two groups. The first group is the exfoliators, which remove dead skin cells from the surface of the skin. And by removing the cells, we clear them and we gradually fade the existing spots. So the exfoliators treat the existing spots. The other group or family are the melanin inhibitors. Melanin inhibitors does not treat the existing spots, but rather the future spot or the cause for the spots. In every treatment for hyperpigmentation that we give to our patient, we have to include the two families or two groups of ingredients, the exfoliating ones and the melanin inhibiting ones. Sometimes they exist in the same products, the melanin inhibitors and the exfoliators, and sometimes they are in two separate products. One is exfoliating, one is melanin inhibitor. So if we look at the Biofor products, we have for the exfoliators, we have Renew, Bright, and Lactophyll. And for the melanin inhibitors, we have actually Skin Tone. We have another product which is also inhibiting melanin production or balancing melanin production, but it's not as strong, as powerful as Skin Tone, so it will not replace Skin Tone. We sometimes give it in addition to Skin Tone. It is called Light Cream. Light Cream is a moisturizing cream that it contains 3 ingredients that balance melanin production. Now we have some products that are doing the two actions both. Double Pill, Renew Plus, Lactophyll Plus, both contain peeling ingredients and also melanin inhibition ingredients. Now also we have 3 azelaic acid products that contain azelaic acid, Azelite or Azocare or Azolite Plus, 3 products that we can also put in this group of products that also inhibits melanin production and exfoliates. That's not very good exfoliation, but there is exfoliation and melanin inhibition. Yes, and later on we will speak about how we choose the right exfoliator, how we set the treatment protocol for the home treatment and the clinic treatment. So we have generally 2 kinds of hyperpigmentation, the functional hyperpigmentation and anatomic hyperpigmentation. Okay, the functional hyperpigmentation is when some melanocytes produce excess amount of melanin. Those are actually most of the cases that we see in the clinic, when there is in some places hyperproduction of melanin. Okay, so to this group belong solar hyperpigmentation and hormonal hyperpigmentation and post-inflammatory hyperpigmentation and pigmentation from medication, from drugs, for example. And this kind of hyperpigmentation we treat with exfoliators and melanin inhibitors. Okay, and the other group, which is called anatomical hyperpigmentation, it's not excess production of melanin, but it's proliferation of melanocytes. They proliferate, okay? Okay, so in this group we see mainly age spots, okay, or where they call it a solar lentigo, not so a senile lentigo, okay. But also we see in this group lentigo simplex and birthmarks and seborrheic keratosis and moles, okay. So mostly in this group, we treat the age spots, and when we treat age spots, we cannot use exfoliants and melanin inhibitors because it would not give us the results. Yeah, that's because the exfoliators exfoliate in the superficial layer of the skin, and the spots are not in the superficial layer, but they are down in the basal layer. And the melanin inhibitors are not necessary because we don't have problem of excess melanin. We have a problem of excess melanocytes. So this also won't contribute. So in those cases, you can either use IPL device because IPL is targeting the melanocytes, or use a special kind of peeling. We call it spot peel. Spot peel, we do it with applicator, and we are doing it only on the spot. Okay, so now we have a very, very important distinction between two situations. One is when the melanin system is not balanced, and one is when the melanocytes are balanced. So when the patient comes to our clinic, sometimes he had an event that caused the skin to produce a large amount of melanin. He had hyperpigmentation, but nowadays when he's at our clinic, his melanocytes are quiet and balanced. They do not produce nowadays excess amount of melanin. This is one kind of case. I will give some examples. For example, with post-acne brown marks, where when it was acne, when he had acne, he produced a big amount of melanin, and he produced some spots. And now the skin is quiet and balanced, and the melanin, the pigment system is balanced. But he had something in the past, like acne, like women that undergone deep peeling, and she had burns, and she created hyperpigmentation. But there has passed one half year or 1 year, and the pigment system now is quiet and balanced. Or maybe he had skin disease in the past, or maybe last summer he had prolonged exposure to the sun. Any kind of events that in the past aroused the melanin pigment and the melanin system, and it created a lot of pigment, but now the pigment system is quiet and balanced. Those are all the cases that we call them melanin pigment balanced. On the other hand, sometimes the patient is at the clinic, and nowadays when we ask him the correct questions, we find that even nowadays the melanin system is not balanced. For example, maybe the hyperpigmentation started when the patient started taking the pills for any contraception, and nowadays she's still taking those pills, or nowadays she's with a device, a contraceptive device. Maybe the pigmentation started when she started the new medication, and nowadays she's still taking the medication. Or maybe she's now pregnant, or maybe breastfeedings. All of those examples are examples for causes that raise melanin production. It's important to notice that the current cause for hyperpigmentation doesn't have necessarily to be the original cause. Like, for example, maybe the hyperpigmentation was created due to pregnancy, and now she's not pregnant, she's breastfeeding, or she's exposed very much to the sun. Sun exposure is also considered to be a factor that, because of this factor, the melanin pigment is not balanced. Okay, so the two kinds of, let's call it situation, require two kinds of therapeutic approach. So when the melanin system is not balanced, okay, we have to do to put efforts on three things. One is an emphasis on melanin balancing or melanin suppression, to put an emphasis on melanin suppression. Two, I will get to details. Two is managing expectations, or to set expectation with the clients. And 3 is to preserve the results. So the first point is to put an emphasis on the protocol, the treatment protocol, to put an emphasis on melanin inhibition. We can do it by using 2 or 3 times a day skin tone, for example, or maybe to incorporate into the protocol one of the azelaic acid products, because azelaic acid is also contributing to the melanin inhibition. So 2 would be managing expectations. It means that we have to speak with our client, especially if she is pregnant, and to set expectations and to tell her that while we are giving her good treatment, she is producing excess melanin. So she won't get very fast results, okay? By the way, we do recommend to treat pregnant women. We do recommend, but we have to speak with her and to explain that we won't see 100% outcomes. We will get improvement. Yes, and the third point will be to preserve the results. What do I mean? When we get the good outcome that we wanted, that we aimed for, we will still have to use melanin inhibitors. Why? Because the melanin pigment is not balanced. The melanin system is not balanced. So we have to contradict this by continue using melanin inhibitors. So we don't necessarily have to continue using the exfoliator, because the exfoliator is treating the existing spots, and we clear the spots. So we don't have to keep it in the protocol, but we have to keep the melanin inhibitors because they treat the reason for the spot. Of course, if we want to keep the client's skin beautiful and young looking, and to preserve the appearance, we can continue using this exfoliant, but not for hyperpigmentation treatment, but for beauty treatment or anti-aging treatment. Okay, now we go to the next group when the melanin system is quite balanced. Okay, now in this case, our emphasis is on peeling, good exfoliator, and with melanin inhibition, we should incorporate, but we can give it for one application a day. We don't necessarily have to give 2 applications a day. Maybe at the beginning 2 applications when we start the treatment, but later on we can go down to 1 application with the melanin inhibition, but to give a good exfoliator. And in those cases, we can use one of the combination products. Our products that contain in the same product, peeling ingredients and melanin inhibition ingredients. Now, maybe I wasn't so clear before. When we spoke about the cases when the pigment system is not balanced, it's necessary to use not only melanin balancers, also exfoliators. I hope they understood, so maybe you should, yeah, always when we treat hyperpigmentation, we have to put an exfoliator in the protocol, because the exfoliator is treating the existing spots. So we cannot give only melanin inhibition. Let's go to the discussion about how do we choose the correct exfoliator. So in every case, we have to choose the exfoliator, we have to choose the melanin inhibitor, and actually all of the exfoliators are good. But when we choose the correct exfoliator, that's the difference between good treatment and excellent treatment. So when do we choose Renew? Renew, we will choose in 2 cases. Yeah, so the first case, when the clients have, in addition to hyperpigmentation, she have or he have signs of aging. So in Renew, we can target the good exfoliation for the hyperpigmentation, and also we can efficiently treat the signs of aging. The second case can be maybe young patient, but the hyperpigmentation is old or very stubborn. Like this patient, for example, she is 26 years old, so she is very young. But this is a severe and old hyperpigmentation. She was many years tanning at the beach, and this is the outcome. So here we will choose a intensive exfoliator, although she is young, but we needed intensive exfoliators to combat this deep and stubborn hyperpigmentation. So this was Renew. Now let's speak about when will we choose lactofil as the exfoliating part. So lactofil is a gentle exfoliator with 10% lactic acid and 2% salicylic acid. So when we have young patients with mild hyperpigmentation, especially when it's young and dark skin patient, because lactofil is very good for all the skin phototypes, even 5 and 6 Fitzpatrick scale. And also with the post-trauma skin, as we will speak later, when we treat the post-trauma hyperpigmentation, when it's recent post-trauma, not old, but recent post-trauma, the melanocytes are very sensitive to any kind of sensitizer. So lactofil is gentle enough to start a safe treatment. Also, when we treat very sensitive skin or skin that tends to hyperemia, very delicate skin, sometimes we treat people that stay relatively longer outdoors in the sun, exposed to the sun. So lactofil is not so intensive, so it allows us more treatment days. Lactofil, actually, like all the other exfoliants, is allowing us to treat red marks after acne. Of course, red marks are not pigmentation, it's blood vessels. But if we mention lactofil, it should be noted that it's very good for red marks after acne. And lastly, when we want to treat the darker skin types, like 5 and 6 Fitzpatrick, it's okay to give them a Renew, but not at the very beginning. At the beginning, we will give them lactofil, and then when it's finished, we can work our way up to a Renew. So they will start using lactofil, their skin will tolerate the acids, the pill, and then we can progress to Renew later. Okay, so this was lactofil. Now let's speak about Bright. Bright is a very good exfoliator with 15% alpha and beta hydroxy acids, also 10% urea, which is also exfoliating. So it's basically good for all the hyperpigmentation treatments, but in the fair skin in Fitzpatrick scale, not the dark skin, like 1, 2, 3, and 3.5 in Fitzpatrick scale. This is because the content of the glycolic acid, we have in it 8% glycolic acid. So basically, we give Bright for the younger people, younger patients with the mild or moderate hyperpigmentation, and also, of course, red marks after acne. Okay, now let's speak about double pill. This is an effective exfoliator, although it's less intensive relatively to Bright. It's less exfoliating than Bright, but it combines 2 melanin inhibitors, kojic acid and arbutin. It is suitable for all the skin types, even Fitzpatrick 5 and 6, because the composition is a little bit different. It's 8% lactic acid, 5 glycolic acid, and 2 salicylic acid. So it's not so much glycolic acid. This is why it's suitable for all the skin types. So who will get from us double pill? For example, we can give it for the young patients with all the skin types. For example, for the kind of hyperpigmentation that nowadays the melanin system is balanced. So we can give one product that does two activities, and this will be the treatment. One product, only one product that exfoliates and balances the melanin. And because the pigment system is balanced, we don't need skin tone in addition. So it's a cheap and simple treatment. Of course, when the melanin pigment is not balanced, so at the evening, the patient will apply double pill, and maybe after that skin tone, and in the morning, he will apply skin tone. As another example, when our patient have red marks after acne, but he is prone to hyperpigmentation. Prone to hyperpigmentation, it happens with ethnic skin or medium to dark skin or mixed heritage, when the skin have tendency to create hyperpigmentation with every sensitizing agent. So if he had red marks, although he is light skin, but he have the tendency to create melanin, so we give him, for the red marks, we give him double pill. So we get the exfoliation and also prevention. So the red marks would not turn brown. Another case, when our patient had hyperpigmentation and she or he got good results, we have no hyperpigmentation, but they have tendency to hyperpigmentation. So also in this case, we want to preserve the results and keep the skin quiet and balanced. So we give him a product that is double action, exfoliating and keeping the skin balanced. And also for patients that want to groom the skin and want beautiful skin, and we want to give them exfoliator, but those patients tend to hyperpigmentation when they go out to the sun, and every little insect bite or everything cause them hyperpigmentation. And we want to keep the skin and to prevent hyperpigmentation from occurring. Yeah. Okay, this was double pill. Now Renew Plus. Renew Plus is basically similar to the former one, to a double pill, because this is also a double product with exfoliating ingredients and melanin inhibition ingredients. So it's the same formulation like Renew, the original Renew, with retinol and 15% hydroxy acid. Yeah, it's 15%. Retinol, yeah, 15% hydroxy acids and 1.6% retinol. And in addition, we have the two melanin inhibitors, kojic acid and arbutin. Now, the depth of the peeling is not the same as the Renew peeling. Renew, the regular Renew, is more intensive in the peeling aspect. So if we want to rejuvenate the skin and we don't have pigmentation, we give Renew. We don't give Renew Plus. When we give Renew Plus, also we have, for example, aging skin. When she had hyperpigmentation and it was cleared up, and we want to preserve the results when this patient is prone to hyperpigmentation. So she now doesn't have hyperpigmentation, but she easily develops hyperpigmentation. So we keep the good look, the good situation with Renew Plus that exfoliates and keeps the melanin pigment balanced. Or for grooming and treating aging skin, and also when we want to prevent although she doesn't have hyperpigmentation at all, but we want to prevent it. She's maybe many hours outdoors and so on. Although when she is she's a couple of hours outdoors every day, we cannot give Renew because Renew is intensive. So we give another exfoliant. But if we have a reason to believe that this skin is prone to hyperpigmentation, we should give Renew Plus. So we have two kinds of Renew for the light skin, Renew 1 to 3, and Renew for the dark skin, Renew 4 to 6. Okay. And we have a Lactofil Plus. Lactofil Plus is very, very gentle exfoliator. It is so gentle, so we can put it even in around the eye area. For example, when should we give Lactofil Plus? I said the eye area, also the armpits and the bikini line, all the gentle areas of the body. Yeah, also when we want to rejuvenate the skin, and this patient is prone to hyperpigmentation, as I said before, because this is a combination product. I forgot to say, this is a combination product. I forgot to say, Lactofil Plus is like Lactofil. I mean 10% lactic acid and 2% salicylic acid, okay? In addition, we have 2 melanin inhibitors, kojic acid and arbutin. So the depth of the peeling is less than Lactofil. Lactofil is a much better exfoliator if we're speaking about exfoliating. So Lactofil is gentle, but it's more exfoliating than Lactofil Plus. So when we want to gently rejuvenate the younger skin, like around the 30s, so we want to rejuvenate them and also to keep them from developing hyperpigmentation, because they are prone to hyperpigmentation. This is one case, for example. Also for recent hyperpigmentation after recent trauma, when the skin is very sensitive to any agent and any irritation. Also, when we treat red marks after acne, and we want to prevent the darkening of the red marks. We do it, of course, only with the ethnic skin or in skin that is prone to hyperpigmentation. When we have a patient with light skin and not prone to hyperpigmentation, we don't have to do this prevention. Also, when we treat post-acne brown marks with the brown skin, with dark skin. So those are mostly the cases that we use Lactofil Plus. And the last product is light cream. As I said, it's a moisturizing cream. It's not necessary part of the treatment. It's not mandatory, but it's contributing to the treatment. So this could be the moisturizer in the protocol, in the skin regimen. It's not replacing skin tone. We will add it to skin tone. This will be the moisturizer. It's not as intensive as skin tone, so it cannot replace skin tone. But when we add it to the treatment, we get faster results. So, for example, we give it to patients that are prone to hyperpigmentation, also to acne patients who have dark skin or medium to dark skin or ethnic skin, or for example, for patients that are having a series of IPL treatments or microneedling treatments or every invasive treatment, especially series of treatment, that we want to keep the skin, balanced and safe. Okay, so we have two very important topics in here. On the left side, we can see a kind of chart between 6 to 10 that we rank the intensity of the exfoliants. So every cosmetologist or doctor can sense the intense of the peeling, the depth of the peeling, and would choose correctly the right exfoliator. Like 10 grade gets renew for the light skin. And below we have renew for the dark skin, which is a little bit gentler. And then the renew plus, which I said it's not as intensive as the regular renew. And bright gets the 9 score, which is a good score. And so on and so on. You can look at this chart. Okay. And another important topic is how can we enhance the effect of the ingredients? So for starters, maybe they should stick to the regular guidelines. But yes, but the more you are experienced, you can go out of the box and do several combinations that are creative and could get you faster results. So for example, when you want to put a huge emphasis on the melanin balancing or melanin inhibition, so we can apply one of the azelaic acid products on top of the exfoliator. Like for example, at the evening, you wash your face, you put Renew, and in 20 minutes or 30 minutes, you put Azocare or Azalite Plus. And after that, after like 20 minutes, the patient will apply skin tone. We don't skip skin tone. And this is good for cases that we have like a storm in the melanin pigment. It's very, very active. Another creative way to set a protocol is to increase when needed, only when needed, to increase the exfoliation. So when we need to do it, not always it's necessary, but we can apply double doses. What's a double dose? So double dose is applying the exfoliator, and after 20 or 30 minutes or more, the patient can apply another layer of the exfoliator at the same evening. Now it does it not necessarily every night. It's enough to do it 3 times a week to increase the treatment, the whole treatment. Yeah, so for some evenings, he will apply 1 layer, and in the other evenings, like 3 evenings, he will apply double layer. So of course, if he will do it with a double product that is exfoliating and melanin inhibition, if he will do double doses, it will increase the intensity of the exfoliation, and also it will increase the intensity of the melanin inhibition. And if we would want to increase the peeling at the clinic, the professional peel at the clinic, we can do some other things. For example, to combine azopil. Azopil is a professional peel for the clinic. So, so we will combine azopil as 1 layers of the peeling at the clinic, of the HA peelings on the clinic. Also, we can apply Dermapil before the peeling. Also, we can stop the home exfoliator instead of a week before the treatment. We can stop it 4 days before the treatment. That's not for sensitive skin, also only for normal skin. And to come back to using the exfoliator, the home exfoliator in 2 days instead of 4 days. Of course, it's depending on only if the skin is calm, you know. Yeah. Okay. So how do we combine the azalite product into the hyperpigmentation treatment? So we're speaking about azalite, and azalite is irritating product. It's not like Azocare or Azalite Plus. Azalite is irritating, so we have a way to introduce it into the treatment, into the protocol, without irritating the skin, but with contributing to the treatment. Okay, so first we will ask, when do we want to introduce it to the treatment? So we have 2 cases. Case 1 is when the treatment is not progressing as we thought it will be. It's maybe progressing, but not as fast as we thought. So we assess it after 1 month and a half or 2 months, not immediately, because you know, hyperpigmentation does not give results in a week or 2 or 3 weeks. So we wait like 1 month and a half or 2, and then decide whether we want to accelerate the treatment. So this is 1 case, and the other case is with hormonal hyperpigmentation, and this could be at the very beginning of the treatment. If we have an hormonal factor with the hyperpigmentation, we can start from the beginning to using azalite along with another exfoliant. Okay, so we have to notice that azalite cannot lead the treatment as an exfoliator because it's not a very good exfoliator. It cannot be the dominant exfoliator. The dominant exfoliator will be Renew or Bright or Lactofil. But we can give azalite in other days, like 3 evenings on the week, we can give azalite as the exfoliator, and in top of azalite, we apply skin tone. And the other 4 days, we apply the main exfoliator like Renew, Bright, or Lactofil, and on top, skin tone. So this was how we combine it in the treatment. Like in other days, not in the same day, we cannot combine azalite and Renew in the same day, in the same evening, because azalite is irritating. So we do it in other days. Yes, but as I said before, we can combine in the same evening Renew or Bright or Lactofil with Azocare. And maybe azalite plus. Those two are not so irritating. Okay, so when we build the skin regimen or the protocol, how do we build a gentle regimen so we don't irritate the skin? When we, for example, combine azalite with Renew in other days, how do we do it gently? So how do we do it gently? For example, for the first week, the patient will apply Renew, only Renew every other day. And second week, it can apply 1 day Renew and 1 day half dose of azalite. And in the third week, the patient can apply 1 day Renew and 1 day half dose of azalite. Maybe I will remind what is half dose. Half dose is to take the active cream, like a pea size, and to take a moisturizer, the same size, pea size, to mix them on the hand and apply. So half dose is when we lower the concentration to half of the original concentration. And for example, if we combine azalite with Bright, so in the first week, we can use Bright every evening. And second week, it will be 1 evening Bright and 1 evening half dose of azalite. And lastly, the third week and on, the patient will apply 1 evening Bright and 1 evening azalite, full done. So as you can see and guess, we can build, a gentle protocol for the beginning, so we won't start the treatment with stress to the skin. So of course, we will proceed to the next stage, to the next protocol, only if the former protocol is okay and the skin can tolerate the treatment. Okay. Now I want to note the several uses of skin tone, because it's not only to be used in hyperpigmentation treatment. Of course, we use it as a part of hyperpigmentation treatment, but we use it also for prevention. For example, when we want to treat, we want to give a series of invasive treatment for our client, like microneedling, like deep peeling, like, I don't know, IPL and devices, okay, that irritates the skin. And we want to prevent hyperpigmentation because this patient is prone to hyperpigmentation, is ethnic skin, or mild to dark, moderate to dark skin with Fitzpatrick scale. So a week before the treatment and also a week after the treatment, we give skin tone. If they are very dark or very prone to hyperpigmentation, maybe it will be even 2 weeks before and 2 weeks after. The therapist should decide. Also, we have those patients that are very exposed to the sun. They have hyperpigmentation, but they have so much exposure that we cannot give them the exfoliator at all. But it's useful to give them the skin tone to minimize the damage. So when they come to us in the winter, when we can give the exfoliator, we minimize the damages. Also, many young women are doing on the upper lip area, like waxing or hair removal. And by doing it, it's causing stress, and they have this darkening of the upper lip. So if this patient will be always using skin tone, it will be a very good prevention. And I want to remind, although I said it, that skin tone can be applied on every area of the body and the skin. The gentlest area, like the eyelids, we can apply skin tone. Now, that's a very important topic. We have, let's call it the hyperpigmentation questionnaire. This is in addition to the regular questionnaire. We call it in Israel anamnesa or anamnesis, okay? Okay. So we want to deeply inquire and understand each patient, each hyperpigmentation, because each one have a different story and a different events that influenced and now influence on this patient and this hyperpigmentation. We want to inquire them all to adjust the correct protocol. So those will be the questions that we will ask our patient. How long do you have the hyperpigmentation? When did it start? We know that the older is the hyperpigmentation, the more efforts we have to put in it, the more it will take to clear the hyperpigmentation, and we have to set expectations. Also, we would like to ask what happened before it arose. What happened? What caused the hyperpigmentation? This will be leading us to understand the kind of hyperpigmentation. So, for example, a patient can tell us that it appeared after he started to use a contraception device or pills. Maybe she had stress. Maybe she was in Thailand for 3 months and then it appeared. So when we know the cause for the hyperpigmentation, and sometimes it's more than one, of course, we can target it more accurately. Now, we want to learn a little bit more about the process. The process, has it gotten worse over the time, changed over the time? So maybe client can tell us that there was a time that the doctor gave me a retinoid ointment or adapalene, for example, retinoid prescription, and it was very much improved. But then I got to a vacation and I stopped using it and it got worse. So we can assume that, okay, this patient is responding very well to retinoids. Maybe I give her a new product, for example. Maybe it's the opposite. Maybe the patient will tell us that the doctor gave me a retinoid prescription and my skin got red and very sensitive and very inflamed. I had flakes and I stopped using the product. So we can assume maybe this is a very sensitive skin. Maybe we shouldn't give renew. Maybe we should give a more gentle product and follow and monitor the treatment to see the skin is okay. For example, when I'm speaking about hearing the story of the patient, I could give one example of this woman. This patient is 51 years old woman, that she had very mild hyperpigmentation, not this that you see in the before picture. She had mild like hormonal and also solar hyperpigmentation, but very mild. And she went to the doctor, and the doctor gave her a prescription of the triple combination. I don't know how you call it, Kligman prescription or triple combination, but it's the combination of retinoid, steroid, and hydroquinone. It's retinoid, hydroquinone, and steroid, hydrocortisone. That's a special prescription that the doctors give to the patients. Now, she had in the prescription high percentage of the retinoids, so she had irritation and the pigmentation got worse. So with this situation and with the inflamed skin, she went to another cosmetologist. This time it was cosmetologist, but not the cosmetologist that got the result, another cosmetologist. And this cosmetologist had a very, very invasive and irritating treatment that is not acceptable for any hyperpigmentation. And of course, the hyperpigmentation got worse. And with this situation, like you see in the picture, a severe hyperpigmentation, she got to the cosmetologist that gave her the correct treatment. So this cosmetologist listened to the story. She inquired, she knew that this patient's skin is on stress. And because it was in stress, she didn't give her a intensive exfoliator like Renew. Although Renew is very suitable for severe pigmentation in aged skin. So without this story, Renew is okay. But with this story, Renew is not okay because this is a stressed skin. So she gave this patient Lactofil and 2 times a week, 2 times a day skin tone, once in every evening. The first week was every other day Lactofil and twice a day skin tone. And then every evening Lactofil and twice a day skin tone. And then they proceed to 3 times a day skin tone because the melanin system was very disturbed and not balanced. So 3 times a day skin tone. And the next month, 3 times a day, this patient applied double doses of Lactofil, double doses, like every other day, it was a double dose of Lactofil. So it's very important, even the hyperpigmentation looks aggressive and looks not nice. If we have a stress in the skin, it's very important to start a gentle treatment, especially with the dark skin tones. So this was an example for listening to the story and adapting to the protocol to the story. Of course, we have to listen and to see what are the habits and what does she do for living? Does she do jogging and how much she's outdoors exposed to the sun? This also affects the protocol. We will see if it's an hormonal factor in the, she's taking pills, she's with the contraceptive device. Maybe she have a medication that is linked to hyperpigmentation. These are things that we have to inquire. And also medications that are linked to hyperpigmentation. It's important, I think I said that, whether they tried other treatment and which treatment they tried and how did they respond to those treatments. And of course, it's important to verify that we have cooperation with the client. So if it's not cooperative, I don't start the treatment because I want compliance from the patient. Otherwise, we don't get results. Now, of course, there is the assessment by the eye. How does the spots look? They look like age spots. They look like hormonal hyperpigmentation. What does they look like? We take into consideration the Fitzpatrick, of course. How old is the client? We ask ourselves if the melanin production is now balanced or not. Maybe there is more than one type of hyperpigmentation. When we have more more than one type of hyperpigmentation, we will address all of the types and we will combine them to build the protocol. Later, we will speak about how we will build a protocol according to the type of hyperpigmentation. So for now, only we have to notice which kinds of hyperpigmentation do we have. For example, I have one good example, maybe I have it here, like this woman, this is an example for mixed hyperpigmentation. So in the before picture, we can see that she have a mild hormonal and solar hyperpigmentation, but in the low side of the cheek, she got a burn. She cooked and a little bit of oil jumped on the cheek and she got burned. And this is the consequence of the burn. So when she came to the clinic of the cosmetologist, it was 3 months after the burn. So it is considered to be a recent stress. So if there was not a burn, this patient should be getting a renew and skin tone because she has signs of aging and we want quick results. But because the skin was still in stress, the cosmetologist did not give renew. She gave Lactofil and twice a day skin tone. So for the first 3 months, this woman got a Lactofil and skin tone, and only later on, she got renew because she need renew and skin tone. And so when we get mixed hyperpigmentation, more than one kind, we have to see the traits of all of the kinds of hyperpigmentation and combine them into an intelligent protocol. By the way, this is the forehead of the same patient. And this is what is good to get a very neglected skin. We see visible results when it's neglected skin. So it's a very good result. And then maybe we should use this picture to address another topic of hypomelanosis. Yeah, hypomelanosis is less melanin production. Yeah, it's not necessarily not lentigo. It's not necessarily vitiligo. It's not necessarily vitiligo. Sometimes our patient comes to us with severe hyperpigmentation. Now, if we were to open the picture and look at it very deeply, or look at the skin with the lamp, we should see, maybe we can see patches or areas with hypopigmentation. Now, they are not very dominant because the dominant thing is the hyperpigmentation. But when we clear the hyperpigmentation, we can see now on cleared and beautiful skin, we can see the hypopigmentation. And now, most of the times, the patient is not aware of the hypopigmentation because he's concerned with the hyperpigmentation. He doesn't see the hypopigmentation. But when the skin is nice and clear, he can see the white spot, and he can say to the cosmetologist or the doctor, look what I got from your treatment. And that's, of course, not because of the treatment. It's more dominant now when the skin is clear, but it's not because of the treatment. So that's why it's so important to speak with the client and to show him the hypopigmentation area and to set expectation and to tell him when the dark spots will be cleared, you will see more clearly the hypopigmentation. Now, this happens mostly with the medium to dark skin types, but it can happen also in the light skin, in all of the Fitzpatrick scale, it happens. Okay, so we were speaking about the hyperpigmentation questionnaire, I think, and now, yeah. Okay, so now we are going to speak about the different types of hyperpigmentation. Okay. So let's start with hormonal hyperpigmentation. Sometimes we call it the cause exists. Cause exists, I mean the melanin system is not balanced. Yeah, so when it's not balanced, we of course have to emphasize the melanin inhibition, like giving 3 times a day, 2 or 3 times a day skin tone. Maybe combine azellite to the treatment, azellite or any azelaic acid product. Of course, we will choose the correct exfoliator according to the age, according to the intensity of the hyperpigmentation. And in addition, as we said before, we have to set expectation, and after we get the results, we have to maintain the results. I think I forgot to say it before. I'm sorry. When we have the existing cause, like when the melanin system is not balanced, also we have to continue using the melanin inhibitor, because even when the pigmentation is behind us, okay, the cause still exists. The melanin production is still not balanced. Mm-hmm. So we have to proceed in using the melanin inhibitor. I don't remember if I said it, so we will say it now.
Yeah.
Okay, I think I said it before, but okay. So if the melanin pigment is still being produced, we don't skip the skin tone. Now, if the cause does not exist, if the pigment system is now balanced, we don't need necessarily to be using skin tone. We can skip skin tone, okay? And another thing, we can, while treating the hyperpigmentation, we can use skin tone only 1 time a day, not necessarily 2 times a day. Of course, it's never a mistake to always use skin tone twice a day. It's okay, it's good for the treatment. All I said is when the melanin production is balanced, it's not necessary to do it. Okay. Sometimes it begins as hormonal hyperpigmentation and darkens on the sun exposure. So this is more intensive hyperpigmentation. So here we will put a big emphasis on very good exfoliation. Actually, good exfoliation and 2 times with melanin inhibition, because this is a severe hyperpigmentation. Now we have like a flow chart for all of the kinds of hyperpigmentation. How to actually this flow chart is like a magician. It tells you how to treat every kind of pigmentation. Let's take an example. It's important for me to say this flow chart is not replacing your head and your consideration and your knowledge. It's only a kind of checkout if you are in the right direction. So for example, if it's hormonal hyperpigmentation, we ask ourselves, is the melanin system balanced, or as we wrote here, does the cause still exist? So if the answer is yes, we continue, we ask ourselves, do we see additional signs of aging, not only pigmentation, some more signs of aging? But if the answer is no, I don't see signs of aging, I have another question. Is the pigmentation severe or old hyperpigmentation? So if the answer is yes, it's severe hyperpigmentation, we have protocol number 2. And if it's not severe hyperpigmentation and not additional signs of aging, so the answer is no, we have protocol number 3. And we have in the booklet, not here in the presentation, but in the booklet, we have all of the protocols, like 16, 17, 18 protocols, according to all the kinds of hyperpigmentation. Yes, but even without the chart, we can, it's very reasonable. If, for example, the cause of the hyperpigmentation still exists, so we know we have to combine skin tone 2 or 3 times a day in the treatment. And if we have additional signs of aging or severe or old hyperpigmentation, we will use Renew as the exfoliator. So you actually know all those considerations, and still it's very convenient to use the chart to check yourself out. So that's for hormonal hyperpigmentation. Now let's speak about stress hyperpigmentation. So this is PIH, post-inflammatory hyperpigmentation. So when we're speaking about trauma, it can be a physical trauma to the skin or a mental trauma, like mental emotional stress. Like if we're speaking about a skin trauma, it can include IPL treatment, epilation, dermabrasion, peels, cuts and bruises and rashes and skin disease and wounds, for example. Okay. Now, it's very important to see if the inflammation or if the stress is recent, because even if the patient is now cleared, like a month ago, the patient undergo a deep peeling at the doctor's clinic, and she got burns and bruises and flakes, and the skin was very red. But now it's not red, it's not flaky, it's calm skin. But it happened a month ago. Even if the skin looks calm, it's not really calm. So even if from the outside it is looking calm, if we were to go inside, the melanocytes are very responsive, and the immune system components are still there and still sensitive and responding to any kinds of stress. Mm-hmm. So we consider 3 months from the initial event, from the initial stress event, to be like a sensitive month. The skin is sensitive in those months. The more intensive was the stress, we go up to 6 months from the initial event to consider the skin like sensitive. So as long as the stress is recent stress, we treat the skin very gently with gentle exfoliator like Lactofil or even Lactofil Plus. And we give a skin tone for 2 or 3 times a day. And on the first 3 months from the stress, we don't give professional pill at the clinic because this is stress. So after 3 months from the event, we can give a professional pill at the peeling, Biopill glycolic, or sorry, it won't be Biopill glycolic, it will be Biopill lactic, because Biopill lactic is more gentle, it's gentler than glycolic. Now, when the stress is old, like half a year or more, so we can select a good exfoliator because it won't be stressed to the skin is calm. And for the skin tone, we can use it twice a day, once a day, even it's not, it doesn't matter. Yes, for the beginning, maybe we should give twice a day a skin tone, but as we progress, we can use once a day. Okay, so this was stress hyperpigmentation. For example, this patient is an Ethiopian patient. She was 38 years old, and she had emotional trauma. This is not a skin trauma, it was emotional trauma. So even when she was pregnant, she has 3 children. Even when she was pregnant, she didn't have hyperpigmentation. She didn't have pregnancy pigmentation. So when she had the stress, in short time, the pigmentation went out like this. And because she was in stress, she didn't receive like a renew for the dark skin. She received Lactofil with a gentle starting, like the first week was once in 2 days, and then once every day with skin tone, and 3 times a day skin tone. After 3 months of this treatment, she got renew. This picture is, I think, 7 months from the beginning. But in 3 months, she got a very prominent progress. Okay, so this is the flow chart, but you can see it afterwards. We have a flow chart for every kind of hyperpigmentation. So we will proceed to solar hyperpigmentation. So that's a relatively easy one. We can treat it, by the way, with IPL device whenever we have IPL device. And also, if we don't have IPL, we have a good treatment with, we have to choose a very good exfoliator according to the intensity of the hyperpigmentation, according to the age of the client, you know, and twice a day skin tone. And every month or month and a half, we get the client to our clinic to do a professional peel at the clinic. Actually, with all of the kinds of hyperpigmentation, we get our client to the clinic once in a month or month and a half to have a professional peel. And in between the treatments, the client uses at home the home products. And of course, when the client comes to us for the first visit to get the peeling, it will be only 1 application, not 2 or 3 or 4. But the next visit, it will be 2 or 3 applications. Next visit, 3 or 4 applications, up to 4 applications. Also, when we do the application at the clinic, we can accentuate, we can pass on several spots with the gas pad to like rub the skin to do more the deep skin in more severe spots. Okay, this was solar hyperpigmentation. Now let's speak about post-acne hyperpigmentation. Okay, especially when we're treating the dark skin area and the dark skin patients, sometimes during the active acne, we already see hyperpigmentation. And sometimes it's very tempting to give the hyperpigmentation treatment during the acne treatment, to mix all of the treatments, acne and hyperpigmentation at the period. But it's very important to make an order, a logic order, and to first balance the acne skin so they won't be coming out new papules and pustules, and only then to address the hyperpigmentation. Yes, otherwise, if we were not to balance the skin, we were only running, we would be always running after new spots, because new papules and pustules. So we have to balance the skin and then gradually start to using the hyperpigmentation treatment on
Sure.
skin. And also we have to keep in mind that the same very product that treats the acne is treating also the hyperpigmentation. When we give azelaic acid to our acne patient, the same azelaic acid is treating already the spots, so we don't have to be worried. So the closer we reach to a situation of balanced skin, it doesn't have to be 100% balanced, but the closer we are to balanced skin, we can incorporate skin tone, we can incorporate treatment days with the hyperpigmentation treatment. So some days we will treat the remains of the acne, and some days we will have hyperpigmentation treatment. Okay, so let's look about the difference between PAH and PIE. So some of our patients, the medium to dark skin, the ethnic skin, will get PAH because the skin is very responding to every sensitizing agent to the acne. And even if they are, while they are having acne, they have PIE, in time, the PIE will get to be PIH. So the red marks will darken. And some of the patients are only PIE. The fair skin, like Fitzpatrick 1 or 2, some of the 3 Fitzpatrick that are not prone to hyperpigmentation, will always have PIE that will fade in some months. They will not get dark. So if we suspect that our patient will get PIH, even though now we have PIE, but in time we suspect he will get PIH, we want to do prevention. We want to give him melanin suppression at this point, so the spots would not be darkened. And of course, if we assume those marks will stay red and then pink and then will fade, we don't need to give melanin inhibition like skin tone. Okay, so we started to speak about post-acne. We spoke about the difference between red marks and brown spot. I did it now. So with post-acne scars or marks, if the client is prone to hyperpigmentation, we can give him a double product. Double product, it means we have exfoliation and melanin inhibition, like double pill, like Lactofil Plus, for example. Okay, and when it's a fair skin and it doesn't have tendency for hyperpigmentation, we can give an exfoliator to treat the marks, to treat the scars, but not including melanin suppression. So we have to look carefully on the skin, because some of the patients are like fair skin, not dark skin. But if we look at the skin, we see the tendency of darkening, like in this case. Or like this case, as we see in some pimples, we have already darkening. Okay, this of course is very easy to assess. This is the dark skin, and of course every pimple will leave a red, brown spot. So this patient, for example, we should give him light cream, which is a moisturizing cream with the melanin suppression ingredients. So this is the flow chart, but we don't need to review it now. Let's speak about mixed hyperpigmentation. So as I said before, sometimes it's more than one kind of hyperpigmentation, 2 or 3 kinds even. Like for example, sun spots and the age spots. or senile lentigo with the post-trauma hyperpigmentation, or melasma with the post-acne spots, and so on, as it's in the slide. So how do we approach those cases? So we defined each kind of hyperpigmentation with the same patient. We decide the kinds of hyperpigmentation. We know the rules, we know the recommendation, and we mix all the recommendation to one intelligent protocol. Like the example I gave you before about this women that has a PIH combined with all the hormonal and sun hyperpigmentation. Okay, so another thing I call it. It's not scientific. It's my term. I call it the panda effect. This woman have hyperpigmentation all over the face, but also dominant pigmentation in the eye area. This woman is also having hyperpigmentation all over the face and in the eye area. So if we were to treat only the resting areas of the face and we wouldn't treat the eye area, we can reach to a point where the pigmentation all over the face is cleared and the eye area is more dominant, like a panda bear. So it's very important to incorporate a treatment for all of the eye area in order not to make such a prominent difference between the other skin area and the eye area, like to give Lactofil Plus, which is very gentle, combined with skin tone to the eye area. Okay, so this is the panda effect, and I would like now to speak about a little bit about age spots. So those were treated with IPL combined with skin tone. It's not, age spots are not to be treated with the home products. It's not enough home products. I want to remind that the age spots or senile lentigo, it's not excess melanin. Lentigo, it's proliferation of melanocytes in the basal layer. So we treat it whether with IPL device or with a spot pill. Yes, so this woman, for example, was treated with IPL. Why did the cosmetologist give also skin tone? To prevent hyperpigmentation from the stress. In this case, also the same. This patient is prone to hyperpigmentation. The cosmetologist knew it. And for this reason, she gave a skin tone a week before and a week after the IPL treatment. But it's important to notice that the result, the improvement is not due to skin tone, it is due to the IPL treatment. So, and this is when you have IPL device. If you don't have to have IPL device, I will show now, not show, but I will tell you now how we do the spot pill. I don't have an applicator, so you have to imagine applicator. So how do we do the spot pill? By the way, in the picture, we see the before, and a week after the treatment, it looks not so nice at all. It looks frightening even, because the skin will be darkened. But after like 10 days to 13 days, the darkened spots will be fade, and the spot will be cleared. So how do we do the spot pill? Spot pill, for example, if we had some spots, we put some Vaseline or petroleum or shea butter or calming mask, any oily ointment on the borders of the spot. Now we take Biofor glycolic. This will be the peeling, Biofor glycolic. Yes, we pour it into the mixed bowl and dip an applicator, not this applicator, you know. We dip an applicator and apply only to the spot between the borders. Yes, and we leave it, we like rub the skin, like we want to, you know, to get the peeling, the deeper we can. We rub the skin, like we want to erase the spot. And we leave it for 2 minutes. And then we take another amount of Biofor glycolic, dip the applicator, and repeat. We do this Now the spot will be darkened. During the treatment, the spot will be darkened. It doesn't look nice. And the next few days, the spot will be darker and darker. But later, in sometimes a week, sometimes 10 or to 13 days, the spot will start to fade and to disappear. Sometimes we will need another treatment, sometimes not. We don't know for advance. And this is not as effective as IPL. IPL is more effective, but not every cosmetologist or doctor have this device, so that's an option. So now, actually, we finished the session, but I want to give some case studies so we can check ourselves to see if we understood. So maybe I will come back to you. Elena and Eugene, you are here with us, right? What I suggest, Elena, is that I will present some case studies, and maybe our participant would write in the chat what would they give to this case, and let's see if they start to process all the information. What do you say?
Nice idea. We can check our knowledges. Thank you for that idea.
Yeah, so let's try it, because I could give the case and the protocol and the case and the protocol, but this would not give them the chance to practice.
Nice idea, let's try.
So let's look at some cases. I will share again. This is the presentation, I think, yeah? Okay. So let's look at some cases. We would start from some simple cases. Like number one, 26-year-old woman, Fitzpatrick 2.5, mild melasma. It developed in the first pregnancy, and she's now breastfeeding. So, let's see what you think. Keep in mind that I don't give unnecessary details. Everything I wrote and said is necessary for the treatment protocol. So take into consideration every detail and see what you would give to this patient. A young woman with the, so if anyone is ready to write in the chat box. I see one answer, lactophyll and skin tone. Another suggestion? How many times to the participant that wrote this answer, how many times will the client apply skin tone? Once a day, twice a day? What do you suggest? Let's see on the chat. And also participate 2 times a day. Yes, I see. Thank you. Thank you. Thank you. That's a good one. Also, the participants that don't want to share, but share with yourself, write down the protocol so you see what was your way of thinking, and then we will discuss. We had a good suggestion because it's I agree with you. We have a young woman and mild hyperpigmentation, so lactophyll and also alternatively bright would be enough. They both can be enough, or lactophyll as you suggested, or bright as exfoliator will be enough. And 2 times a day skin tone, because we have the existing cause, because the melanin pigment is still being produced. Why? Because she's breastfeeding, and while breastfeeding, the melanin system is not balanced. Okay, so number 2 will be the same case. Young woman, 26, but Fitzpatrick 4. She's dark skin, 1 year from the birth. She has mild melasma as before, 1 year after the birth with contraceptives. So let's see if we have any suggestion. Renew 4 to 6, skin tone 2 times a day. Thank you. I'll let you some seconds, and then we will speak about those 2 protocols. I suggest everyone to write down for himself the protocol that you think you have to give. Okay, So let's speak about the first suggestion, renew for the dark skin, 4 to 6, renew for dark skin, and twice a day skin tone. This was the first offer suggestion. Okay, so this can work properly, but this patient is young with mild hyperpigmentation. So although this is a good protocol, we don't necessarily need such a strong exfoliator. We could use a lactophyll because it's dark skin. Yeah, it's not a mistake. This will give good results, but we also at the same time could give lactophyll, which is a mild exfoliator, and get also good results. As for the skin tone, she is very right. We have to give 2 times a day skin tone because she is in contraceptive. So the melanin system is not balanced. So that's good. Okay. The second protocol was azelaic acid product with 2 times melanin, 2 times skin tone. So 2 times skin tones it's okay. Azelaic acid cannot carry all the treatment and be the dominant exfoliator because it's not very good exfoliator. So we prefer to give a good exfoliator like Bright, which is not suitable now, it's dark skin, lactophyll or Renew Plus. Yeah, I was a little bit confusing. I said Renew Plus, I meant Renew for the dark skin, not Renew Plus. Yes. So, okay, we got some suggestions. Thank you. Let's look at number 3. 40 years old woman, Fitzpatrick tree, melasma that came out in the first birth and got worse in the second birth. And further, it was darkened when she was exposed to the sun. So it's a severe hyperpigmentation. It was hormonal originally, and then she was exposed to the sun. And now it's 6 years since the second birth.
Renew Plus 4 to 6, then also azelaic acid cream.
Okay, what about skin tone?
They say yes.
Skin tones, how many times?
3 times a day.
Oh. Okay, any other suggestions? Okay, meanwhile, let's see the chat.
Yeah, another option is Renew 4 to 6, skin tone twice a day. And one more option, lactophyll and skin tone, and then add Renew.
I wonder why to start with lactophyll and then proceed to Renew. Why not to start Renew? If you could ask.
So that the skin has time to adapt and doesn't give pronounced reaction, so that it doesn't get irritated too much.
So I want to say something. Fitzpatrick tree is not considered to be a dark skin. We consider dark skin 4, 5, and 6 of Fitzpatrick. So, and also we're not afraid to cause any stress when we start at the very beginning using Renew. On the contrary, we want to give very fast and visible results. So we want to start with Renew. And in this case, we don't see a stress condition. So we don't have to be delicate and careful. So everybody that suggested Renew was right, was correct. We want to start and give Renew because it's intensive hyperpigmentation. It's too, and also old hyperpigmentation. It's after 6 years. She has it for some, quite some years. So it's old and severe hyperpigmentation. It's very logical to choose Renew. Also, she's 40 years old, so it's very suitable. So we had what suggestion for Renew 4, 6, and we don't necessarily have to give Renew 4 to 6 because this is a light skin. This is not a dark skin. We could give Renew 1, 3. Yes, and for skin tone, they're all right. We can give skin tone, that's okay. And if anybody suggested azelaic acid, in the protocol, not instead of the renew, not instead of skin tone, but to combine azelaic acid. This is also correct. So let's go to a relatively simple case. A girl or a boy, 18 years old, Fitzpatrick 2, so it's fair skin, red marks after acne, no pimples. Lactofil. The suggestion was lactofil. Thank you. Do we have another one? Okay, let's speak about bright. Good, good, very good, Maria. So Maria and Nina gave us protocols. Actually, the both suggestions are okay. Because actually, when we have red marks, no acne, red marks with fair skin, the only product that we should give is an exfoliator, whether it's lactofil, whether it's bright, they're both okay. Number 5, the same case, red marks, but Fitzpatrick is 5. We have Azalite Plus. We have bright and skin tone 2 times a day. Okay. That was Victoria. Victoria suggested bright and skin tone 2 times. And Mina is suggesting Azalite Plus. Another one? Okay, let's speak about what we got. Thank you for the protocols. Victoria, you suggested bright and skin tone twice a day. That's a very good one. Sorry. That's not so very good one. Skin tone is good because we want to prevent, but bright is not for the dark skin. With the dark skin, we don't give bright, we give lactofil. So you could give lactofil and twice a day skin tone. And you also could give a combination product like a double pill or double pill you could give, and lactofil plus also. Now Mina suggested Azalite Plus. Azalite is a azelaic acid as an ingredient. It's not so much exfoliating, so we cannot rely on the azelaic acid to get exfoliation. When we deal with red marks, we want to exfoliate the skin in order to help the skin fade, the marks to fade in time, gradually fade. So Azalite would not be enough. We should use an exfoliator, and to use melanin inhibition, it's okay. Azelaic acid is melanin inhibitor, but we have exfoliating agent into the protocol. So in case number 5, we could get a lactofil and skin tone, or lactofil plus or double pill. Yes, let's look at case number 6. 25 years old. She has pigmentation in the upper lip area only. She performed waxing once every 2 weeks, Fitzpatrick 3. The treatment is, we should leave it. We should leave this sentence. So Fitzpatrick 3, every 2 weeks she has waxing on the upper lip and pigmentation, 25 years old. Let's look at the chat. Victoria is saying skin tone, and what else on skin tone?
Tatiana put double peel.
That's a good one. Okay. Lactofil plus skin tone. That's a good one also, Mina. So let's speak about the suggestion. Skin tone alone would not be enough. When we have existing hyperpigmentation, we have to combine a skin tone with exfoliating products. Later on, when we clear the hyperpigmentation with this client, we could leave only the skin tone to be applied like 4 days before and 4 days after the waxing. All of the suggestions that were double products like Lactofil Plus, Double Peel, all are correct. All are correct. I will add also skin tone for the morning because we have now a stress for the skin, so we need a skin tone in the morning, as Mina wrote. So we had good ones. Let's go to number 7. Number 7, the same case. Young woman waxing, but she, sorry, not so young, she's 37 years old. 37 years old. Now, I wanted to note something. When we spoke about the 25 years old, the treatment can be done only on the upper lip area. She doesn't necessarily have to put it all over the face because she's 25 years old, she's very young, and we assume the skin looks beautiful except for the... Now with the 37 years old woman, maybe you would like to set a protocol, not for the upper lip area, but for the entire face. So tell me if you intend to suggest a protocol for the entire face. Let's see, I see anyone. Double peel and light cream. Double peel, that's interesting. Victoria says yes, so she suggests to put the product all over the face. And we have a suggestion, double peel, skin tone, all over the face. So who would be applied all over the face, the skin tone or the double peel?
Both.
Both. So this is an interesting discussion. Let's look at it. This patient does not have pigmentation all over the face, only in the upper lip because she has stress in the upper lip. Now, it's not recommended to give melanin balancer or melanin inhibitor when with the cases that we don't have the problem. It's not healthy for the skin to apply solution when we don't have a problem. So in this case, in one hand, we want a beautiful skin and we want to apply exfoliator all over the skin because she's 37. So I would suggest to apply all over the skin exfoliator without melanin inhibition, like Bright, for example, or like Renew. And only for the upper lip area to apply skin tone. And this would be more accurate without you know, messing with the healthy areas. Okay. They didn't do like a big mistake, but it's not the most accurate protocol. Okay, let's look at number 8, a woman, 55 years old. She have age spots on the skin, Fitzpatrick 3.5. She's prone to hyperpigmentation. Biofor glycolic or Renew Plus 4 to 6. Mina is suggesting Biofor glycolic by spot pill. Maybe ask her if she meant a spot pill. Good. Or Renew 4 to 6. Renew 4 to 6 skin tone. We have another suggestion, Renew 4 to 6 and skin tone. I want to remind you that age spots or senile lentigo is not responding well to home products. We can give them, but we won't see the results we expected because aging spots are proliferation of melanocytes, not of melanin. So let's refer to Milana suggestion. So spot pill is very good. This is what will be dominantly in the protocol, the spot pill, or IPL if you have. Now renew 4 to 6. Let's discuss it later. Renew 4 to 6 is good for the skin generally to keep very groomed in the nice skin, but it's not a treatment for the age spots. I want to add to Milana's suggestion another thing. A week before and a week after the spot pill, it's recommended to apply skin tone. Because the client is Fitzpatrick 3.5, so she's prone to hyperpigmentation. We want to prevent hyperpigmentation because of the spot pill. So that's true that you have Renew Plus at home, and Renew Plus contain melanin inhibition, but we have to stop a week before the spot pill. We have to stop applying exfoliators. So she will stop applying the Renew Plus, and we want melanin inhibition, so it will not be enough for us. So if we will summarize, these are age spots. They don't respond to topical exfoliants and melanin inhibitors. We have to do whether spot pill or IPL device, and we have to protect the skin before and after these treatments. Now, number 9 is the same case, but in addition to the age spots, she has also solar hyperpigmentation. So this is mixed hyperpigmentation. Okay, we have one. Renew Plus 4 to 6 and Azocare. Let's see. Renew Plus, Renew 4 to 6 and Azocare. I want to say something. We use the products for dark skin from 4 to 6 Fitzpatrick. 3.5 is still considered in the light skin for using products, not for protecting. We should protect Fitzpatrick 3.5. We should protect it. So when we consider which skin we have to do prevention, 3.5 we do prevention. But when we ask ourselves which product to adapt, whether it's for dark skin, whether it's for a light skin product, we give the 3.5 the light skin products. So let's look at the suggestion, Renew Plus 4 to 6 and Azocare. This can work. This can work, okay, because she has also solar hyperpigmentation. I would add the skin tone 2 to the protocol, but this could be okay. But we have to add to the protocol a solution for the age spots, because home products cannot treat age spots. So we'll have to do either a spot pill or a IPL. Okay, we have another from Milana, Biofor glycolic. I assume it's a spot pill, skin tone, and light cream. Milana, what about the age spots? So it's good. The spot pill, it's good. Biofor glycolic, I'm sorry. I'm sorry. I did not understand. Biofor glycolic is spot pill. So it's good. Biofor glycolic is spot pill, and skin tone is prevention or protection, so it's good. But light cream is also good. But we have a good treatment for the solar hyperpigmentation, and I don't see it in the protocol. So because this is not a so young a woman, 55, we will give her a Renew product for the solar hyperpigmentation. Okay, So let's look at number 10. 20 years old woman, Fitzpatrick 5.5, so it's dark skin. And the last remains of the acne, and the skin is almost balanced. She have the last pimples that are on their way to go out. They are shrunk and almost fully healed, and many brown spots and scars remain. Maybe it's a complicated one. Lactofil plus Azocare. Wow, that is a good one. Is it new, Lactofil plus and Azocare? I think it's new.
Yes.
That's very good protocol. Lactofil azolite, very good, very good. So you're thinking correctly. You added to the protocol treatment a component for exfoliation and for continuing to treat and balance the acne skin, because the acne is not really finished, it's almost finished. So you put azelaic acid, that is very good, and you put lactofil because she's dark skin and we have to treat the hyperpigmentation and the post-acne. That's very good. For Mina, it's a quite good protocol, but lactofil and azolite are good. I would add also skin tone because it's 5.5, it's very dark skin, and we will need much intensive melanin inhibition. Okay, so let's look at another one. 30 years old woman, Fitzpatrick 3. She is pregnant with mild melasma, open pores, and remnants of acne scars. Bright and skin tone, very good. How many times skin tone? Yeah, 2 times a day. Victoria is saying 1 to 2 times. So I tend to agree with 2 times a day because this woman is pregnant and the melanin system is not balanced. So we have 2 times, maybe even 3, depends, but minimum 2 times a day of skin tone. And bright is very good suggestion because we have a mild melasma and also open pores and acne scars. So bright is a good exfoliator to treat all of the conditions. So that's good. We have some more. Do you have the energy to proceed some more? So let's look at 12. 38 years old woman with melasma that developed after starting use hormonal contraceptive device. The device still exists. And during duration of the pigmentation, 7 years, Fitzpatrick 3.5, neglected facial skin, not so good skin, not nice skin, with signs of aging, and the treatment begins in the winter. Renew Plus 1 to 3 as exfoliator, Azocare, skin tone. Very good. Double pill, skin tone. This is another one. Double pill is good, but in the description we see a skin that has signs of aging and doesn't look nice. So we prefer to give the best exfoliator and the best rejuvenating product, which will be Renew. Renew is better than a double pill. It's not a mistake, but a better skin and faster result we can get from Renew. Yes, of course, skin tone will be applied twice a day, not less, because the skin is not balanced. The melanocytes are not balanced. So Next is the same case, but the Fitzpatrick is 5. Renew plus 4 to 6 and skin tone. Excellent. Actually, the only difference between the cases is the Fitzpatrick, so we give them an exfoliator that is suitable for the dark skin. This is the difference. Okay. 14. IPL treatment performed at another clinic ended with burns that left spots along the back. So these patients have IPL treatment on the back, and the treatment left burns and then spots. The Fitzpatrick is 3.5, and the case is relatively new, about a month ago. So remember, we're speaking about recent stress. Okay, let's see. Azocare Lactofil Plus, that's interesting. Yeah, that's a good one. Also, if we want to proceed, also take into consideration, this is a fresh or new stress. So we have to get emphasis on melanin inhibition. So when you incorporate skin tone will be applied at least twice a day, because now, a month after the trauma, the skin is sensitized. Okay, let's look on the last one. Same case, half a year has passed since the burn. Let's have a look. Renew plus 1 to 3 and the skin tone. Okay, that's a good suggestion. Lactofil plus and skin tone, I want to address this one. Half a year passed after the trauma. I said that we were in the same case half a year after. So half a year after, the skin is not sensitive, it's not in stress, and we are striving to give a very good exfoliator. Okay. So Renew is a good one, Bright is a good one, Double Pill is a little less. So 16, it's an interesting case, a male, 13 years old. He have a allergic rash for some months. It's was a real case that we treated, a male that have a allergic rash on the face for some months. Is Fitzpatrick 4, and the face was healed. He got medication, and the face was healed. And it happened about a month ago that the allergic reaction has recovered, and now he have the remains. He have pigmentation after this. So how do we treat it? Very good. Lactofil plus and skin tone. Excellent. That's Bina. Lactofil plus and skin tone. That's very good. Another one was Azocare. Azocare alone. Lactofil plus every other day. So one day Azocare, one day Lactofil plus. This is the protocol. Let's speak about it. First, we see a skin that is very sensitive, unbalanced, dark skin. The skin is very reactive to any tiny sensitizer. So we have to give a big emphasis on the melanin inhibition and delicate treatment. So in the first protocol, this is perfect. We use the Lactofil plus every day and skin tone twice a day. This is a perfect protocol because it is delicate and contains many melanin inhibition. So it's a good one. The next one is good, but not enough because we have to add some more melanin inhibition into the protocol. Azocare is good for melanin inhibition, but in this case, we need stronger melanin inhibition, like skin tone. So I would add into the protocol also skin tone. I can leave those products, that's okay, but to add the skin tone. In the real life, we have this patient. This patient got lactofil and twice a day skin tone. Those days we didn't have lactofil plus, so we got the regular lactofil and 2 or 3 times a day skin tone, and we got very good results. So we have the 2 last cases. 17 is a 26 years old woman, young woman. She returned from a trip for several months. She was in Thailand. She was a lot of many hours a day in the sun, so she got sunspots. And now it's winter, and she's Fitzpatrick tree. So we have some, and let's see, Renew plus 1 to 3 and skin tone, and the former one, lactofil plus light cream. Lactofil plus light cream. Let's look at it. Okay, and I'm looking at the chat. So that's a young woman. I didn't mention if the pigmentation is severe. If it's not a severe pigmentation, so this protocol will be okay. Lactofil plus and light cream can be okay. If it's a severe pigmentation, maybe we add some more intensive peeler exfoliator. Also, we could give Bright as an exfoliator. Bright is a better exfoliator, and it's good for Fitzpatrick tree. It is good for Fitzpatrick tree. Victoria is suggesting Renew plus 1 to 3 and skin tone. I would say in 26-year-old woman, which is merely a girl, she's very young. It's not necessary to give Renew. Renew is intensive. It's good when there is signs of aging or severe pigmentation. If the pigmentation was severe, that's a good idea and good protocol to give Renew. Okay, and we have the last case, 18. 35 years old, Fitzpatrick 3.5, having epilation treatments once every 3 weeks in the face area. She wants to start with for all solar pigmentation that she has for a decade. How will she combine the epilation treatment with the lightening treatment? Lactofil plus, skin tone, spot peel. Why spot peel? It's not age spots. Also, take into consideration, this is old pigmentation.
Okay, skin tone before the procedure, 4 days before and 4 days after, and Renew 1 to 3.
Very good. Very good. Also, to stop, you want to translate the protocol? Yeah, this is correct. So because we have severe and old hyperpigmentation, we use Renew. I agree. I would give it 2. And skin tone before and after the procedure, this is also correct because we want to prevent hyperpigmentation. This is also correct if you can translate. And also we have to stop using Renew a week before the treatment in those areas that that we treat. Like if, for example, the epilation is in this specific area, so only in this specific area, the patient should stop using Renew a week before the treatment and to go back to Renew like a day or 2 after the treatment. As for the other suggestion, Lactofil Plus and skin tone and spot peel, I don't see why we have to do spot peel because it's not lentigo, it's not a senile lentigo. So I didn't understand why spot peel. Now, Lactofil Plus and skin tone are good for mild pigmentation, but in this case, we have 10 years of pigmentation, so it's not so mild pigmentation, and that's why we gave her Renew. Okay, so this is it. Let's stop the sharing so I can be with you. So this is it. You have any questions?
Clear. Thank you very much for the very deep seminar. We will waiting for recording.
Yeah, of course. Sure.
Thank you, Ronit. It will be very interesting information.
Thank you. You were very good, very patient and very good. And I'm sure you will get best results. And by the way, feel free to join us to Biofor Global Training in the Facebook. We have a specific group, closed group in the Facebook, Biofor Global Training. You can consult us, consult Elena or Biofor. We will be happy to assist. So have a good day.